Hi, everybody. It's Deborah Carter here with Preparation Tech. Today, I have a fantastic interview with Dr. Sam Mazin, who is based in Silicon Valley. He is an engineer and he also has a background in healthcare and medical imaging, this kind of thing. And I'm talking to him because he's an inspiration. He actually created a new technology that he's going to talk about, and it's basically bio targeting oncology. Big words. He's here to explain what that means. Welcome, Sam. Please introduce yourself and tell us what you do and how it intersects with technology.
Thank you, Deborah. Nice to be here. Yeah, so my name is Sam Mazin. I am a founder and chief technology officer of RefleXion Medical. I am inventor of the company's technology. So I was a postdoc student over 10 years ago, and I had an idea to essentially make cancer treatment better. I didn't really know that this idea would actually become a company, but the idea involved a new technology that would marry two other technologies together, and we can talk about that. That would result in a machine that would treat all stages of cancer. So fundamentally, yes, I'm an engineer. I'm also an inventor, and really excited about this technology, which hopefully will one day really help people all over the world.
Awesome. So now comes the interesting part. Can you describe this technology in very simple language? What does it do? How does it work? And why is it different than the other cancer related technology out there today?
So it relates to my background, as you alluded to as well. I'm an engineer, but I also received training in healthcare, specifically in the radiology department of a university. And what radiology does is it studies how we use energy, in many cases, X-rays, to see inside the body, right? It's a diagnostic field. It helps you tell a patient, why they are ill, why they are sick, why they are hurting. So I knew a lot about the seeing inside the body part, but I knew very little about the treatment part, where in some cases you can use those similar uh, energies like X-rays to actually treat disease, specifically cancer. And so I attended a chance lecture um, in another department, a department called radiation oncology, which sounds like radiology, but it's actually very different. It involves the treatment part, using X-rays to treat cancer. And when I sat in this lecture, I was just thinking about marrying essentially two concepts together for the first time. This way of seeing the cancer, which is called PET imaging. And PET is a type of scanner that some people may have heard of. It's a way to visualize where cancer is in the body in a very sensitive and specific way. And my idea was to combine that with the radiation therapy part, where you're using X-rays to treat the cancer, and to do that in a way where literally the cancer is actually sending out signals, and a machine that I conceived, but uh, ultimately many other engineers designed and built um, to make this a reality, that would actually respond to those cancer signals to be able to treat that disease anywhere and everywhere in the body. So it's really a combination of two technologies: PET scan imaging and radiation therapy. The seeing cancer and the treating cancer finally in the same device together, to hopefully make cancer treatment much more effective.
Okay, so great explanation. Now I'm going to go a bit rogue because I got to know why did you focus on cancer? What was it about cancer that made you say I've got to make this innovation? There's problems to be solved. Is it a personal kind of cause for you, or is it just something you're interested in?
Well, I'm sure all of us have stories of cancer, unfortunately. I certainly have it in my own family and extended family. But it actually wasn't the original motivation. I was studying medical imaging in a very different non-cancer field. And it was actually this idea that I had that led me to this field, that led me to cancer specifically. Um, and it was an idea that I just couldn't let go of. I remember sometimes at night I would actually shake a little bit after I had the idea because I was anxious, nervous. I was wondering what, I have to do something about this. I was getting encouragement, all around me to do something about it. So it led me step by step to actually recruit my co-founder, create a company, to be able to actually realize this idea, this technology. But then, of course, it is personal. The knowledge of people close to me, but also colleagues and others that have been affected by the disease continue to remind me how important it is to just continue to move the field and hopefully improve cancer care.
And I can imagine that is also the impetus for you to keep going when times get tough. You got the eyes on the prize, the big picture there. So I see before me a super driven, motivated person who really wants to help people. So my question is, take us back to your childhood. Can you talk about your childhood? What kind of kid were you? What were your interests? Were there people in your life that kind of influenced you in the direction that you decided to go?
Sure, yeah. So I grew up in a Toronto suburb. I'm Canadian, but living in America now. Um, I was always interested in math and science. That was, from very early on. I just loved those fields. I think because they were just so black and white. They were so right or wrong, very objective. And and then I remember just excelling in those fields. Maybe because I loved it. Of course, my parents encouraged me to really do anything. But when I realized I had a knack for those specific areas, I just continued to dive into it. By high school, uh, I was starting to really excel in those areas. I had, my best friend in high school, who actually became my co-founder for this company later on, and we never knew we would work together like this. He was also someone who motivated me because we would have a friendly competition going. We would compare test scores and exam scores together and push each other in kind of a fun way. Um, I had also had some great teachers along the way. My physics teacher, I'll never forget, Dr. Lai, in high school. I remember how he introduced physics to the class. He said he wasn't really going to be teaching us physics, but rather he was going to be learning physics with us, because it was, it kind of just struck me, in school you get the sense that everything is okay. Here's this information and it's going to be shared with you, and you're going to learn it, you're going to write it down, you're going to memorize it or just understand it. But his comment made me realize that many of these fields are still being discovered, right? And they're not set in stone. They're changing, and so I loved that. That kind of made me realize you can actually discover something new. And he kind of brought physics down to the level of reality that it is for his students with that simple comment. But it certainly it was one of those moments where it kind of strikes you, and you realize something about life that you just didn't realize before.
So take us from high school. So you loved high school. What happened next? Did you study in Canada or did you go to the US? So what happened?
Yeah, so I was really looking to. I think it was the competitive nature in me that I wanted to really just continue to challenge myself and push myself. And I just looked at all the disciplines that were out there. I was looking at medicine. I was looking at engineering. What attracted me um, was a program at a school called the University of Waterloo, which is in Canada, which just had a stellar engineering program. There was a relatively new, I shouldn't say new, but it was a very popular discipline at the time and growing in popularity because this was around the time of the dot-com boom. It was computer engineering. And I was very attracted, I loved computers, I loved computing. I loved how you could use computers to answer these kind of difficult questions. And so I applied to that program and was accepted. But I think what I didn't really realize about that program, which also became extremely important to me, was the fact that it was an internship-based program. It was they called it a co-op program where you had to spend every 4 months you would transition from a school semester to a work semester, to a semester where you will join a company as an intern and learn that particular technology or understand that company a little bit more. And so by the end of the program, one would develop 2 years of work experience, which went a long way, I think, to shaping me. It was kind of taught me the value of not just acquiring knowledge for its own sake, but applying it, actually affecting the world with it. And it's also a way to actually learn better, I think. I think in many times schools, I think this could happen at every level. You could fall into the theoretical world, but if you don't apply it to real life, it just, not only does it, it's less motivating, but it's actually more difficult to learn. It's much easier to learn something when you can actually work on a concrete problem where you're applying those concepts, and that's a much better way to grasp those concepts. So it was a very important program for me. And through that, I also realized I loved the idea of applying engineering principles to problems, and I wanted to continue that pursuit. So I applied to graduate schools across Canada and the U.S. and then was accepted at a graduate school in the U.S., Stanford University, and was able to I actually got into an electrical engineering program at Stanford, but within the first year, I remember I had a mentor, an advisor. Every master's student is assigned an advisor to help them with their career or kind of life decisions as it pertains to the academics. And I'll never forget, he told me, you really should look at the biological field because computing and biology are starting to come together. And I was focused on computing. I came to Stanford to focus on a field called information theory, which is about communications. It was very mathematical. I loved it. But when this professor opened me up to this idea of looking at biological applications, I just felt, wow, this is a much more direct way to potentially impact humanity, people, solve problems with engineering principles. And so I started taking courses in that. I took a medical imaging course and I fell in love with medical imaging because medical imaging talked about how literally you could use math to see inside the body. And I thought that was the coolest thing ever. How does a CAT scanner work? How does ultrasound really work? We take these technologies for granted now, but there's just so many principles at the core of them that, they're magical to someone who doesn't know. But to me, understanding how they worked underneath the hood was just intoxicating. And I pursued medical imaging in much more earnest and eventually decided to focus a PhD on that. And so that's how I ultimately got into healthcare. I ended up in the radiology department, applying engineering principles to solve medical imaging problems.
Wow. And then from your PhD, did you found RefleXion based on your PhD research?
It was actually shortly after my PhD, I started a postdoc in the same school, and I was focusing on medical imaging. So I loved that field, but it was because I attended that chance lecture that that brought me to a new idea, new technology that was actually not part of my research directly, but it was something I felt I had to pursue, and I'm glad I did pursue it. But yeah, it was certainly very close to the field I was in, right? And because of that training and knowledge I had in medical imaging, I was able to have that insight. Without that knowledge or training, certainly would not have been able to even think up this concept. To build the technology we're working on required a lot of failure, if that's how one defines failure of something not working. Things just don't work until one day they do work, and you have to iterate. You have to keep trying different ways to solve that same problem, and eventually you'll get it. And sometimes you don't, but failure to me is not defined by not answering a problem. It's I forgot who said this to me, but it was also a profound note from a teacher once. It was that failure is actually just not trying again. So to develop our technology required a lot of other different technologies to work together, and each one of those had to be developed and had to be prototyped. There's a specific one that I'm thinking of that was really difficult for us. It's a device in our machine, and it's called a Multileaf collimator. So it's a special device that actually shapes the X-ray beam into the patient from around the patient. And to shape the X-ray beam, our machine had to rotate around the patient at speeds that were much faster than what current radiation therapy systems do. Current radiation therapy systems will rotate around a patient in around 1 revolution around the patient in 1 minute. We had to rotate our radiation therapy system 60 times around the patient in 1 minute. So we're going 60 times faster. And these are big, heavy, these are machines that weigh over 10,000 pounds. So there was a lot, obviously, of trial and error there in terms of just getting these components to work at that speed. But there was one particular component, this multi-leaf collimator, that had, because we were rotating so quickly, this device had to switch at extreme. It's a mechanical device that it had to transition and move and switch at extremely high speeds that had never existed before in the field of multi-leaf collimators. And so the engineering team, I wish I could claim credit for this, but it was beyond my field of expertise. And this is part of doing something new. Is all the time you need to work together with people that can solve different problems and different sub problems. So this brilliant team came together to devise different ways to solve this problem, and we actually ended up building a prototype for 4 different topologies or solutions, 4 completely different ways to solve this problem. And each one became its own prototype where we would see it on the bench and actually see the leaves transition really quickly and test it and retest it. And the actual solution ended up being, we took the 2 best designs and actually merged those 2 concepts. One was based on pneumatics, or using air to move leaves really quickly, and the other one was based on springs to kind of suspend a leaf between 2 springs and have it move really quickly. And so the final design was a marriage between pneumatics and spring resonance that ended up in this multi-leaf collimator. Now, you could say that along the way there were many failures, that this prototype that didn't work and that experiment failed, but that's part of learning. I mean, the only way you can learn and gain new knowledge is to test and put your idea out into the world and see what the world comes back at you with. Like, nope, that won't work. But that's how you push the envelope and the frontier to understand those applications better and eventually make something work. And sometimes things don't work, but thankfully we were able to solve this particular problem. And so the prototyping aspect was riddled with many stories like that over a decade-long experience, essentially. First of all, I think anyone can do this. I honestly do. I think anyone has the capacity to do it, but I think you do need certain attributes which I think can be developed in anybody. The first one is basic knowledge, right? You need to, there's no way I could have come up with this idea if I didn't know the field of medical imaging, if I wasn't trained in how kind of the current science works and the current applications of technology work, if I'm going to take that leap to the next step. So understanding a field was important to me. And I think, anyone who wants to develop a new technology in a certain area will need not just the skills, but much more importantly, the knowledge base of that particular field. What are the problems in that field? What has been solved? What hasn't been solved? Um, and how do things work in that particular area? So I think knowledge base is obviously a very important one. The second one is, you can have that knowledge base, but how do you then make a leap to solve a particular problem? And I think there's different words for the same thing. You can call it creativity, you can call it vision. I think they're all the same thing, where you're basically just um, taking concepts and putting them together, and it's really that simple. You just
Mhm.
that's what happened with me. I think you can almost look at any invention as taking at least one or more concepts, and or at least two or more concepts, and actually just putting them together and saying, so what would happen if this? um, and that's creativity, that's imagination, that's vision, that's all I think the same process happening. But you need those concepts to begin with, and that's where the knowledge comes in. um, and then those two aren't enough, because you can have the knowledge, you can come up with those concepts and put them together, but then you need to actually act on it. And I think that's that willingness to act, that to actually realize something that is just theoretical into something that is real. um, you
Would you
know
call that entrepreneurship then? Is that what?
yes, that's
Yes.
the entrepreneur part. That is
Yeah.
the entrepreneurship part. That's the innovator part. Again, I think a lot of words for that, but it really comes down to an individual who sets as their goal, I want to solve this problem, and encounters many obstacles, but hits those obstacles and tries to go through them or around them or above them, to be able to realize their goal. And so I think it's those three attributes that are really important if you're trying to break into a new field or new territory, even in an area that you already have a lot of knowledge in. You still need to be creative, and you still need to be able to act on it, and be an entrepreneur. And I think all of those qualities, I I don't have really data on this, but it just I can't see a reason why not, are inherent in everyone, and every person has the ability to think, can be able to gain knowledge in a field, can be able to combine concepts together, and can be able to choose to act on it, right?